Hey there, in this video we're going to take a look at how you can better manage lower limb muscle pulls. We're going to use the acronyms PEACE and LOVE and use those to help explain a better strategy when you've pulled a muscle in your lower limb. The most common lower limb muscle pulls we'll see is to the calf and hamstring, particularly with repetitive sprint-based winter sports. The acronym PEACE stands for protection, elevation, avoid anti-inflammatories, compression and education. So looking at protection, essentially what that means is we don't want you to aggravate the injured area. So if you've pulled your calf or hamstring, for etc., you should only be doing pain-free activity on it. Common mistake, people then try and stretch it. So do not stretch it, all right? Do not start strengthening. We're talking about these first 1 to 3 days. Everything should be pain-free in the area that you've injured. Commonly, I'll see people come in and they're telling me about how they've been stretching it a lot. You could still do some activity in that time, maybe doing some upper body, maybe doing some core, but yeah, to the injured area, keep things pain-free. Then we look at elevation. So take every opportunity you can to elevate the injured area above the heart. So if it's your hamstring or calf, you just got to lie on your back with your feet above your heart. Avoid anti-inflammatories. Another common mistake is people, they're buying creams and anti-inflam creams and they're rubbing things on it and they're rubbing Voltaren on the injured area 2-3 times a day. I'll tell you now, stop doing it. The evidence actually says this might actually delay your progress. It will not enhance it. If anything, it's neutral, so you might as well save your money. And while we're on that topic, physiotherapy in that first 1 to 3 days, rubbing something on a specific injured area probably won't help. So when you've injured yourself, you probably want to wait a couple of days for that appointment. Of course, you've got to usually book in advance, but don't get too eager to get that appointment on day one. Compression is the C, so compression hasn't changed from that acronym we used to use, that acronym RICE, which was rest, ice, compression, elevation. Compression remains. So that's we do have compression bandages in the clinic. However, anything you can use to compress the area, just make sure that obviously if it's too tight, you're going to get tingling in the feet or blueness. You don't want to have that. And the compression bandage that you do use, just want to make sure it's smooth throughout. The E in PEACE stands for education. And what I mean by this, apart from what we've already covered above, a lot of people are doing sort of unnecessary treatments in those first few days. In my opinion, and the research that I've read, you don't need needling, you don't need massage, cracking. You don't need to go in and have a whole lot of treatments from different practitioners. You just need to let it be and let the natural healing process occur in those first few days. So it's only sort of from day 3 onwards that you might start to get some specific help from a treatment provider such as a physio. After you've given your body the peace it needs in days 1 to 3 after a lower limb muscle pull, then the area needs some love. The L stands for load, the O stands for optimism, the V, vascularization, and the E, exercise. If we break that down and we look at load, it means that, once the injury has got less pain in that area, we start to load it. And some examples of that is performing some strengthening exercises and some stretching of the area, and then gradually returning to running and running related sports. So there's a few steps that as a physio we can guide you along to make sure that loading scenario is correct. If someone goes from just resting and then straight back into sport, the vast majority of the time you'll just pull that injury, that area again, and it's quite deceiving. Your body will usually roughly let you know when you're ready to progress your load. However, hamstring injuries and calf injuries generally are pain-free walking around after 3 to 7 days, and commonly those who just go back and they haven't done the step-by-step process to increase load again, they'll just pull that muscle and end up worse than you were after the first muscle pull. The optimism, or the O in love, I would say that having a positive attitude towards your recovery can make a huge difference. They have done research that finds if you're pessimistic about an injury or about a specific treatment process, your outcomes will be worse. So yes, you need to be realistic, but being optimistic and open-minded can usually produce better outcomes. The V, vascularization. For a lot of people that we treat in the clinic, they love exercising. Their winter sport or their sport is a big part of who they are. So we want to keep you involved. Getting some cardiovascular exercise is great for the mind. A lot of our clients, they're just not used to doing nothing. So if we can get you doing some cycling, swimming, cross-trainer, rower, skiing with the upper body cycling, there's some alternatives that we'll try and get people back to as soon as possible. Also, getting the blood flow can help improve the healing process as well. The final one, the E in love, stands for exercise. So again, that's just a progression on strengthening the injured area and then progressing to that sport-specific strength. And we do find that those people who skip that higher end strengthening and don't continue to strengthen the injured area, or for some they may need more flexibility, they tend to re-injure that same area again. For some, you might have to take that a little bit deeper and look at like how are you running, video running analysis. I'd say for most people don't need to go along those lines, but if you have had the injury before, you may need to look at those areas. But yeah, exercise is a very important step, that you get that right, and then it prevents that re-injury, because once you've pulled your hamstring or calf more than 2 or 3 times, I've seen it wreck multiple people's careers, and even in the media, if you look at some All Blacks or All Whites or Silver Ferns that we've seen over years, it can wreck your career. So yeah, don't skip that final stage of ongoing strengthening and stretching of the injured area. One thing we haven't touched on is the acronym RICE. So obviously RICE is the most used acronym in muscle recovery from what I've seen in Australasia over the past 10-15 years. It stands for rest, ice, compression, elevation. The only thing that the PEACE acronym doesn't use is ICE. ICE is what I'd say now a personal preference. The research or the ongoing research they've done is a bit up in the air on whether it provides benefit or not. There is some saying that it actually inhibits recovery and some saying it's just neutral. What ice has been proven to do is help with pain relief. So if you're getting discomfort or pain in an area, maybe you're applying some ice. That's mainly the reason that I'd currently use it. The current evidence suggests that it may not actually speed up the recovery process. Okay, I hope you guys found those tips helpful. So we're trying to introduce the acronym of PEACE and LOVE. PEACE in those days 1 to 3. We're going to protect the area, elevate, avoid anti-inflammatories, compress the area, and we're given the education. And then after those 1 to 3 days, you've got to apply some love to the area in terms of appropriate loading, being optimistic about your injury, vascularization, so doing some exercise, cardiovascular exercise, and then the E in love is the exercise, so progressing and strengthening that area so you don't re-injure it again. If you've got any questions about this content, please shoot me an email, peter@healthandfitnesstesting.nz.